In today's words, I see them as some of the first virtual reality. And what's the most fun about them is they're still, in many ways, bigger and more useful and more isolable. You can use them than a set of VR goggles. When my patient's looking at a vectogram, I can look at their eyes. And I can see how they're processing. So I like to have them from that point of view. But what I can do from a patient point of view, what can I show this patient with it, is there's a right and a left. Now, people think of it as a right and a left vectogram. What it is there's the right and the left parts of a picture that exists in a place in space other than the holder. The only special case where the picture's on the holder is when the pictures are essentially aligned at the holder. If you move it so the eyes are pointed behind the holder, you have a virtual picture that's behind the holder where the eyes point. If you arrange it so it's in front of the holder, you have a picture that's floating in space, and that's the real picture. It's a virtual image created from two physical parts. So we can create this virtual image, which the person has to believe what they see to interpret and to use. So just at that level, they're incredibly fascinating. And I think if we can reach back into history to the turn of the last century, when we had stereo cards, people would look at those for hours because they could see the virtual reality. We can now project that into space with vectograms. And with the vectogram in the therapy room, we can very carefully show where things are. We can show which eye is going to be in charge, which eye does the brain like best. You know, I like this one. Okay, but could you like the other one? How about they could be the same? And we can do those things with a vectogram, and we can help the patient understand how they go about seeing the world, which is pretty much a great definition of ET. So can you do this with it? Well, I guess I could. Well, could you learn? Well, I could, yes. Well, are you responsible for what you see? Yes. Those are such critical aspects of visual training that's what we teach with vectograms. That, and they're just plain fun.